Welcome back to Bloom. As we age, we lose elasticity and collagen. Plus, gravity also takes its toll. In the end, many of us find ourselves with extra skin and fat around the jowls, making us look heavier and older than our years. However, Dr. Hermann can fix us. Joining us to talk about fixing those jowls is Dr. Hermann of Hermann Wellness. Welcome, Dr. Hermann.
Thank you, Carissa.
So I think when we talk about anything that makes us look older and heavier, that's not something we want. So what is it about the jowl area that does that, and how can we fix it?
So as we age, our face when we're younger, it's more of sort of a V or a heart shape. And so as we get older, we lose volume in our cheeks, and then some of the volume sort of pools here, and our face looks more square. And so by lifting this little section right here, it really does rejuvenate the face.
Okay, so that's when you're saying jowls, you're kind of saying this area.
So by jowl, we'd be talking about just this sort of, if you know, a jawline that's straight is ideal. And so a jowl is when it starts to kind of curve under. Yeah.
Now for this, is there a one-size-fits-all approach, or are there different treatments?
So many different things, and everything I'm talking about today will be non-invasive.
Okay, good.
Okay, or minimally
most people
invasive.
seem to feel more comfortable sort of starting with those types of options. So how do you know which treatment is best for your patients?
So I definitely evaluate the patient. If they have a lot of volume loss in the upper face, in their cheek, I will sometimes add a little filler, which will lift the jowl, which will actually lift the lower face.
Okay.
If they do not have volume loss, really we focus just on this area. And there's a couple different approaches.
Okay, let's take a look at some of the patients that you've actually been able to work with, and then you can kind of talk us through what you saw and what you did here.
So this person had PDO threads, which are dissolvable sutures that you can put sort of behind the ear and tunnel just along the jaw, and it helps and pull back the skin.
Okay.
So really just skin, someone who does not have a lot of fat in that area.
And it looks beautiful, yeah.
This is
very dramatic.
Yeah, so this is face tight. This is actually a minimally invasive procedure where we go under the skin with a laser and we tighten the skin from underneath.
Now what I'm noticing is there's that line next to her mouth that's really, now is that from the face tight
procedure? It is. So usually when I go under, I'm also going to do the lower face as well as the neck. So it pulls back sort of from the lower face like that,
and change.
I know,
and
I know.
It looks amazing. So men are people that benefit from this as well. And for him, I'm seeing a totally different chin
profile. So this is Kybella. This is basically an injectable made by Allergan, similar to. It's not similar to Botox, but Allergan makes Botox.
Okay.
And basically, what it is it dissolves the fat of the chin, and you can apply it to the jowls as well.
Wait a minute. It dissolves the fat of the chin?
It is naturally, it's a digestive enzyme that helps us digest fats. So we inject it in where we need it, and it just dissolves the fat.
What an amazing treatment option. Now, we talked about three things that were very different, but typically how long did these results that we saw last?
All of them? Okay, so the Kybella and the face tight are years. I mean, honestly, at 5 to 7 years, you're still gonna look better than you looked if you never had it done. Even though in 5 to 7 years, that's when we say maybe, you've aged 5 to 7 years and you might need something again.
Of course.
But they're permanent from that perspective. The PDO threads, the ones that are just little sutures here that are dissolvable, those are a year to 18 months.
Okay, great. And we can come visit you and you're gonna tell us what's perfect for us. So guys,